I'm Saul Balderas. We'll be talking about medical errors today. So, to get started, an error is defined as an act that produces a preventable adverse outcome compared to the natural progression of disease that leads to injury or death. So with that, if we go to the next slide, our issue statement is medical errors and how they impact patients and the providers in the healthcare system. So we looked at the compensatory issues that medical errors cause, as in who's going to pay it. Extra procedures can be expensive a lot of the times if it's workers' comp related. The company, if they're self-insured or their insurance does not want to pay for extra procedures, if they can just do therapy and kind of get better that way, they would much rather prefer that. Also, the possible deaths of patients and those deaths that are avoided because of the catching of medical errors, as in the little safeguards, the little checks, as medical errors are the third leading cause of death in the United States. My mother recently just had her knee replaced. One thing I kind of noticed they did was 4 doctors and multiple nurses came and always checked and asked her what leg she was going to get operated. They did multiple marks. They were looking for each other's marks, and they were just kind of double, triple, and quadruple checking each other to make sure that they were going to operate on the perfect leg. They weren't going to operate on the wrong one. Also, a lot of times with medical errors, the outcome of those deals with some type of permanent damage, as in if they operate the wrong leg, sometimes they go back to fix it. It's not always fixed or heals the same way. There might be an issue, or they might develop a limp or something because of it. So with that, if you go to the next slide, the national context, we looked at safety cultures. When it comes to safety cultures in hospitals, there is kind of 2 different cultures that I came across. One is allowing and accepting that some deaths and errors will happen, versus hospitals that their goal is 0 errors and deaths. With that, one also looks at their hospital values, kind of what they strive for, if they're kind of money driven, as sadly some companies or businesses are. We've read multiple case studies during the school year that kind of showed bad practices going on, that they were overcharging. Recently, we just had a discussion about this one doctor reusing needles and then causing another patient to get hepatitis C and whatnot. So things like that, if they allow things of that nature. Also, hierarchy in hospitals. Sometimes one can imagine surgeons are really kind of the boss, kind of have the last say. So when nurses speak up, sometimes they're talked down, and then now they don't want to talk or give any feedback because they're scared of the repercussions it might have. Also, being reactive versus being proactive. A lot of the times people react or do something about something when an incident happens or someone dies, for example. That should never be the case. One should be looking to make the hospital or the healthcare facility a much safer place, as in adding safeguards, as in double checks, people with double checking each other's work and whatnot. One should strive for that. One should not wait for an incident to happen and then start making changes, as that always kind of falls on the patient, as they're the one who suffers because of it. Also, the private versus public system. There was a study done, and it kind of showed that the patients felt they got better care at private hospitals compared to public. There was about a 15% difference in satisfaction, which is kind of crazy to think. One, when looking to get some type of care or medical attention done, would assume that at all places it's the same throughout, but that's not the case. Sometimes money is a factor, as in private are a little bit more expensive. Sometimes don't accept all types of insurance because not all types of insurance want to pay for it. So paying a little bit more sometimes does give you a little bit better care, but that should never be the case. It should not be money driven. It should all be about the patient, making them have a nice recovery. And with that, we will go into some background information.